What's up, YT fam? Welcome back to another educative video. So please, if this is your first time seeing this face, my name is Abena Boatima. I'm a Ghanaian based YouTuber and the nurse. Your next tuber, Bakupe, no size. So please consider subscribing to this channel if you haven't. It is free. On this channel, there is never a dull moment on this channel. This channel is full of positivity, educational. We have educational topics on this channel, fun topics, vlogs, a lot of things on this channel. I don't want to waste much time. I want us to learn something about cervical cancer. So let's dive into the video. Welcome back, guys. Don't mind this face. Your next tuber is feeling a little bit under the weather. I'm not feeling too well, but this video is so important that it has to be made to help someone out there. I know most of you know something about cervical cancer. Yes, some of you are so learned to the core. Some of you Google, some of you have gone to hospitals to learn about it, but I have to share my thoughts because this is February. Happy new month. February is the cervical cancer awareness month, and we don't joke with this month at all because it is so important. Cervical cancer is one of the fourth most common cancers in women. It is very deadly, guys. If you do not know this type of cancer, then this is the right place for you to be. So continue watching. Watch to the end. So one will ask, what is cervical cancer? It's a type of, simply put, cervical cancer is a type of cancer that affects the cervix of the woman. It's like a malignant tumor. We have types of tumor. We have the benign and we have the malignant. The malignant is the cancerous one. So it's a malignant tumor that affects the cells of the cervix. So that is a simple term that I'll use to describe cervical cancer. One will also ask, what causes cervical cancer? What is the main cause of cervical cancer? Cervical cancer is caused by the human papilloma virus. Yes, human papilloma virus, the HPV. It is transmitted through sexual intercourse. It is transmitted through sexual intercourse. That is why we always advise that people should practice safe sex. If you can't abstain, practice safe sex by using condoms. You understand me? So after the course, we all want to know what are the signs and symptoms. It gets to the cancerous stage. That means you've gone far. But we have the stages. We have stages of the cervical cancer. If detected early, it can be treated. But if not detected early, you might not even feel the signs and symptoms until it is getting to the latter stage, the late stage. So when you are there, you feel that you have painful sexual intercourse, you understand me, abnormal vaginal bleeding, pelvic pain. When you urinate, you feel a lot of pains. When you are having your menses, you bleed profusely. You understand me. You know that there's something wrong with you. It presents symptoms of candidiasis. It presents like that, like you have candida or infection. So you always have to go for what? Your screening. Your screening is very, very important. This is where I take you to the preventive measures. Practicing safe sex. Number one, practicing safe sex. Always make sure you go for your pap smear screening, your pap smear test. Yeah, someone will ask, pap smear, what is pap smear? It's a test that is done on the cervix of the woman. You just come to the clinic or your hospital and you are placed in a position, you open your legs. I'll describe it because most people don't know what pap smear entails. Someone will ask, pap smear, is it a medication? Someone asked me some time ago that is pap smear a medication. I said no, it is not a medication. It's a test that is done on the woman. You will come to the clinic, we open your legs. Yes, we put a speculum there, then we remove something from your cervix to test to see if you have the virus. You understand me? So it is very important for every woman who is sexually active. If you know that you are sexually active, try as much as possible to go for your pap smear. Yes, your pap smear, that like once in every 3 years. Yes, once in every 3 years you have to go for your testing. We also have another testing called the HPV DNA test. That one goes more into details than the pap smear. We have the VIA. One will also ask, can a virgin go for a pap smear test? Because you know that pap smear involves you being, understand? Yes, we use the speculum. I will try to insert the vaginal speculum on the screen so that you understand what I am talking about. We use something called the speculum to enter your vagina. We open it, then we use a tube to, you know, take the sample from your cervix. So if you are a virgin, can you go for a pap smear test? That brings me to this point. The pap smear test is slightly uncomfortable even for those who are not virgins. Talk less of those who are virgins, who haven't been penetrated before. You know, sexual intercourse is when there is a penetration. Yes, that is what we call sex. But pap smear isn't sexual intercourse. But to me, since you are not sexually active, you are not exposed to the HPV virus, yes, the human papilloma virus, and we all know that cervical cancer is caused by that virus. And those who are prone to the virus are those who are sexually active and who have multiple sexual partners. You understand me? So virgins, we advise that you go for the HPV DNA vaccine. Even if you are sexually active, as soon as you go for your pap smear test, after your pap smear test and your results comes out negative, you can, you know, go for your vaccine, the HPV DNA vaccine. It comes in 3 shots. You take 1 shot. If you take 1 shot today, the following month you take another shot, and 5 months later you take the final shot. So it comes in 3 shots. It helps a lot, the HPV DNA vaccine. It is quite expensive in the developing countries. I don't know for the developed countries if it is free there or not, but it is quite expensive here for those who cannot afford it. That is why some people do not even go for their pap smear test. So if you can, you have to always make sure that you take care of yourself, because cervical cancer kills. Guys, if not detected early through the pap smear testing and the HPV DNA testing and all those other testing, you might get it and you wouldn't even know, because the early stages, it doesn't show signs and symptoms of the cancer unless it gets to the later stages where you start having abdominal pain, bleeding, and all those things I mentioned earlier. So always try as much as possible to go for your pap smear test and your HPV DNA test once in every 3 years or once in every 2 years if you can. You understand me? If you are sexually active, make sure you are always doing your pap smear testing and your HPV DNA testing. So the good news about this is that if you are in Ghana currently, you can come to Kolebu Teaching Hospital in Accra. Yes, we are having a cervical cancer promotion screening at the reproductive health of Kolebu Teaching Hospital, Family Planning Center. It is free for the first 50 women. After the 50 elapses, you will pay half of the amount of the usual price. The usual price goes for 150 cedis for a pap smear test, but since it is a cervical cancer awareness month, we are giving a promotion. You can come with your mother, your sister, your daughter to come for the test. That the price will be reduced drastically. So this is such a good news. So I pray that you people will take advantage of this and you will come. I'll put the date on the screen, the date of the screening on the screen, so that you see what I'm talking about. And someone also said that, what age can you be vaccinated? Yes, your daughters can vaccinate. You can vaccinate for children who are 9 years and above or 10 years and above. When you break them, you give them, because they are virgins, they are not sexually active, we give them the vaccine to prevent them from getting the virus. You understand me? So your children can be vaccinated, you the adults can be vaccinated. When you do not vaccinate, you might be prone to the virus. Let's be aware of this. This cervical cancer thing is a serious matter. Let's take care of our health as ladies, as wives, as mothers. Take care of yourself. Take good care of yourself. I don't want this video to be too long. For more information, all my contacts are in my description box, or you can visit a nearby hospital or a clinic to get more information about this. Yes, you can also Google to get more information. I just want to share a little bit about it. I didn't go into details. I wanted to share a little bit about cervical cancer to create awareness that the cancer is real. Cervical cancer is real. Just like HIV is real, cervical cancer is real, and it is deadly. Please stay safe, practice safe sex, and always avoid multiple sexual partners. Thank you so much for watching. I hope this video was helpful enough and it will help one or two people. So I'll see you in my next video. Don't forget to like, share, and subscribe. Bye.